Welcome back to another podcast of Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth about the medical system. Today's guest is Hanna Rosov. She is a personal trainer and one who specializes in the menopausal woman, one person who often shows up in our clinic looking for answers that the medical industry has failed to provide her. She's going to provide you information on what to do about that and some tactical takeaways. From here, I'll let her introduce herself because she's been on quite the journey to get where she is now and how she will help you today. Hanna, welcome to the podcast.
Thank you, Clayton. How are you?
I'm doing very well, and I appreciate you coming on. I know a lot of the times people, especially ones who have not really been on before, are a little bit nervous, but you jumped at the idea with a little bit of coercing from me. Introduce yourself. Tell them a little bit about how you became the Hanna you are now and how you help people today.
Okay. My name is Hanna Rosov. I'm an ACSM certified personal trainer, have been for the last 12 years. I started back at the YMCA a million years ago, and just general training. And the funny thing is as you age, you start to realize what you need and more what other people will probably need alongside you as well. So a lot of my clients I've had for years and years and years, and watching them go through changes with their bodies as they age made me realize that there was a hole in how we treat peri and postmenopausal women. And then when I started going through menopause, I realized there was a really big hole because until you experience something, it's kind of hard to understand the minutia of it. So I started to tailor my training more and more towards peri and postmenopausal women, which now comprises 90% of my training. The ACSM certification gives me the qualifications to know that I'm not hurting people and that I can design a good program. But I've also started doing a lot of research into how to train women so that they can move into this next phase of their life with confidence and with strength and trying to keep themselves independent and moving forward.
I think what I like about what your position is with the menopausal woman, or before, after, and all that, is medical doctors know what they know, and that's usually quite specialized, and it never feels tangible, right? From my understanding, they will send you out of their office with, "We should probably eat a little bit better and start weight training or start working out," and that's it, right? Yeah. And you're like, "Cool, what do I do with that?" And then they start Googling it or Instagramming it or TikToking it or whatever. So I really appreciate that you give some actual implementation ability to these ladies. And another thing that you mentioned that I would like you to dive a little bit deeper on is when I went through PT school, it's the 3-year degree after your undergrad. And it seemed like every year of that 3 years, I found more and more problems with the program where I'm like, well, this is kind of stupid. This needs fixed. Like, they could have taught that better. Maybe the order should have been different. But by the time I got out and they're like, cool, give us all your feedback on what we should change, I'm like, I just want out of here. And I kind of moved on. And I'm curious if women feel the same way when going through menopause at times where it's like, it's hard. Nobody really has answers. And then you get out of it, you're like, wow, that was really bad. But what do we do to help the ladies through it and make it simpler? And I know the medical system doesn't even have necessarily things wrong. It seems like they just don't have information.
Right.
And so I would like you to speak on what have you learned kind of going through womanhood so far, and what have you looked back on and been able to implement for ladies to make things go a little bit smoother and easier? What are some of those big takeaways that you were able to teach because you learned the lesson yourself?
Right. No, that's a great question because there are absolute horror stories out there.
Mm-hmm.
I think sometimes people would be shocked by the things that doctors will say to them. They'll tell them things like, "Oh, honey, this is just how it's going to go now." Or, "Oh, well, you just need to," like you said, "you need to move more and you need to eat better." I mean, I literally had a client tell me that her doctor told her she needed to eat more celery. Well, I'm real sorry, but eating more celery isn't going to cut it.
I'll be very specific.
Right. So the dismissal of especially women by the medical profession is really frustrating for a lot of women. And as humans, we've been trained that we don't question doctors. And I do believe that is changing to some extent. Like, my mom would never have questioned a doctor. She just would have gone along with what he said. And I'm trying to think of, I don't want to be negative because you have to go to the doctor. So I guess how I would answer your question ultimately is I would say, if you go into your gynecologist or you go into your PCP and they are saying to you, well, that's just the way it is, or you need to suck it up, or stop whining. You need to run from that PCP
Yeah,
or
I
that
agree.
gynecologist, because they're really good practitioners out there. There's some really good practitioners out there. And you want to find somebody who will spend a minute and will listen to you and listen to because especially in menopause and perimenopause, estrogen touches every part of your body, every single part of my body, right? And so it's kind of like thyroid. When your thyroid stops working, if it stops working, right, you have all these bizarre side effects, all these things that will happen to you. And it's the same thing with women when they lose their estrogen. You have crazy side effects, and there's hundreds of them, and like frozen shoulder. Well, why would you have frozen shoulder from menopause? But it's a thing. Tinnitus, right? So if your doctor says you just have to suck it up, run and go find somebody who will actually listen to you. And so, but that's the thing that I've learned, is that there are a lot of doctors out there that simply won't listen.
Yeah.
They'll just tell you this is status quo now. This is just, and there are certain things that you're going to have to accept about your body because it has changed, but it doesn't mean you have to suffer. And I think that was the thing. I think I was very lucky in that I had a practitioner who would listen to me, but listening to my clients, it was just
it's bonkers. I mean, I hear the
yeah.
same thing from the PT perspective.
Right.
Of, you shouldn't run anymore. Or
Right.
I had an ACL patient. Well, I saw him 10, 15 years later after the fact, but he was generally a tennis player and also was a runner.
Mhm.
Well, after his ACL surgery, he was in his 30s, so older compared to your stereotypical 15-year-old athlete. But the doctor literally said, you can keep playing tennis, but I wouldn't recommend running anymore. And I sat there and I'm like, that is the most bass-backwards thing I've ever heard. Because like, what do you do in tennis?
Right.
You run back and forth, cut, and all that kind of stuff. But running in a straight line, he should discontinue. And you're like,
right.
Oh my gosh. And the thing is I think it would be helpful if doctors said, I don't know much about that. I think you should go to someone who does.
Right.
Or I don't know much about that. Let me do more research. But just admitting what they don't know as opposed to saying, suck it up, or a version of that.
Right.
That's the most frustrating thing. And the amount of ladies that I've worked with that, like you said, felt dismissed or felt like they were just told to suck it up really changes a person coming from a provider who's got a medical degree and a license that carries a significant amount of weight.
Right.
When they provide advice, good or bad. And that's what's very frustrating.
Well, and part of the frustrating thing is, and I don't remember, I should have looked it up, but I don't, when you go into your specialty of gynecology, they spend 99% of their time talking about how to help women give birth and the things that go along with you while you're right. And I think it's some crazy number, like 13% are given more education on menopause, and you have to actually seek it out yourself as a gynecological practitioner. So the fact that we have, if any woman who lives long enough will go through this, so 50% of your population, whatever, they're going to go through this. And it's just bananas that we don't prepare anybody. We don't prepare our doctors for it. We don't prepare our women for it. It seems kind of crazy.
Do you feel like, so I know there's not been too much, well, there has been more research now, but that's actually still pretty recent. And we know that like by the time a medical textbook is printed, it's already somewhat out of date because it takes so long to get information from learning it and then publishing it and teaching it.
Right.
So would you say it seems like the research may be coming out, but we're just in a significant lag from like information being found to actually getting taught in schools?
Like a Doppler effect.
Oh yeah, for sure. And there was one I was going to lead into with that. I lost my train, but I remember I heard there was a women's health specialist here in Wichita, and she said that when they went through their women's specialty, I don't remember if it was OBG, like obstetrician, or if it was gynecology, but I think they had 1 3-hour course, not 3 hour over the semester, 3 hours, like from 1 p.m. to 4 p.m. in the afternoon, over the pelvic floor and the muscles that make that up. Meanwhile, like their entire focus is the woman's lower body area, and they got such little training. So when you go and ask that doctor, hey, what should I do about pelvic floor? I'm having fill in the blank symptom.
Right.
They actually don't know at all because they weren't educated. However, yes, they can specialize after. So that's a different story.
Sure.
But from base level education, they weren't taught much about that. And that's where, if they would know that there's pelvic floor physical therapists that exist, that would be very helpful.
Right.
So like when you said, run from that practitioner, it's run from that practitioner and to someone else that can help you. And that's where social media, like what we're doing right now with the podcast, asking friends and family their experience and just simply talking about it amongst your circles is so helpful.
Yeah.
And so that's where we'll lead into how you help ladies kind of here in the gym, but then also through discussions and education. But before we get there, what are some symptoms that take place through menopause when you say stuff like estrogen is like drained or estrogen's not there, not doing its job? You say it touches everywhere.
Yeah.
What are some symptoms that either you've went through or you've seen other ladies go through, or what are some things that these gals can expect to kind of potentially experience?
Oh, sure. Well, everybody knows about hot flushes, right?
Mm-hmm.
So everybody's like, oh yeah, that woman's sweating. She must be having a hot flush. And everybody's seen the video with the lady who's steaming outside because
Mm-hmm.
she's, but for me, brain fog was huge. I could not string together a sentence. I couldn't remember. I put things I couldn't put together. Like, I consider myself a decently intelligent person, and actually trying to come out with a thought was really hard. And we still joke about the menopause game we play where I have to describe the word I want to use, and then whoever's with me has to come up with the actual word. You know, it's round and it's in the ground and you dig it out, and they're like, a hole? Yeah, a hole. Okay. You know,
It's like
just
a Jeopardy version of a dictionary
exactly.
definition. Like, what is a hole?
Yeah, what is? Yeah.
There you go.
And so that was hard. The other one, and this is a little personal, but I really want to make sure that women understand this is a thing because I did not know this was a thing, is anxiety and depression. Anxiety and depression for women is enormous. Again, there are statistics out there about how many women will either go through divorce or will go through or will try to commit suicide in their 40s and 50s. And it is, I have never been somebody who's had anxiety. I've never been somebody who had depression. And it hit me like a ton of bricks. I mean, it was shocking to me. And I thought, oh, it's because I have a teenager in the house. And so I want women to know this really is a symptom because your estrogen profiles are changing and it very, very much messes with your brain chemistry. Mm-hmm. So don't, and so again, and I feel like I'm bagging on the medical profession, but a lot of times this anxiety manifests, you start fighting with your partner more, you start fighting with your kids more, right? All this stuff. And then on top of that, you're not sleeping. So you start, for me, and everybody has a little different. I always fall asleep really easily. I mean, it's kind of the joke in the house that I will fall asleep at the drop of a hat, but I would start waking up at 1, and then I would wake up at 2, and then I would wake up at 3, and sometimes I'd have to go to the bathroom, and sometimes it would just be a hot flash, and sometimes it would be, and so you're not sleeping, you have anxiety, your hot flashes, your body is changing, right? So all of these things start leading towards women going, what the heck is going on? And because as a society, we really don't, like, I would tell you women my age and a little bit older. So I'm 56, women my age and a little older who had older parents, like you did.
Yeah.
We didn't talk about it. So I didn't realize that these were symptoms. So that's why I try to be so plain with my clients, that these are things that can happen. This is something that can happen. You can have these, you can have the anxiety, you can have the brain fog, you can have the hot flushes, but it may be something as dumb as dry eyes and itchy ears.
Yeah, for sure. I want to dig a little bit deeper on one thing in specific, if you're okay with discussing, is when I think a lot of people, especially those who don't have bouts of anxiety, I think of someone like shaking in the corner, like, oh my gosh, I'm so worried, or having an anxiety attack.
Oh,
but like, how would you say, either in yourself or how you've seen it in others, like what is anxiety or depression, whichever one, how do you actually feel like it presents? Like, what are these people experiencing? You alluded to it some, where you're fighting with your spouse when you shouldn't be, right? You're kind of making something out of nothing, not blaming, but saying like, you're more irritable. Like, what does that look and potentially feel like?
It feels like you have a right to be the way you're being, but that everybody's looking at you like you don't have the right to be the way you're. Does that make sense?
No, having a couple of kids and watching the hormone changes that my wife's went through and experiencing my own lack of sleep during that process and trying to learn, evolve, and be supportive. Very much so.
Yeah.
That makes sense.
Yeah. It does.
Having lived it, sometimes myself and sometimes supporting my wife.
Yeah. Yeah.
It makes a lot of sense where you feel like you're right, but everybody feels like you're wrong.
Right.
Having the right, that's a good way to put it, though. What you said, I feel like I have the right to be mad, but at the same time, objectively, like, maybe not to this degree.
Yeah.
Type of thing.
Yeah. And the anxiety was just, everything was going to be bad. Everything was going to be awful. Everything was always going to be things, just the worst possible outcome always, and you're just always afraid of it. Like I had this completely irrational fear that at any moment my husband was going to lose his job. Just completely irrational. There was no reason for it. But I carried that around with me. So it's almost like it takes like the thing that you are worried about the most, and it just pumps it up to 100 to where you can't stop thinking about it. It's really, really disconcerting, especially for somebody who has not dealt with that before. It's all of a sudden you're like, why am I thinking about this all the time? This isn't a thing.
Do you feel like there's a bit of an identity crisis that takes place within that? Because that's not you. You've never had anxiety like that. So why do I feel this way?
A little bit, yes. I mean, every body, every human is different, right? And we're all going to perceive it in different ways. But I think if you have the awareness that this is a possibility, I think you are better able to handle it, because then you can say, oh, I know what's going on here, and I can take a breath, or I can go change my patch, or I can, right? Like that was, I know you didn't ask, but that was the biggest game changer for me was getting hormone replacement.
Gotcha.
That was, all of a sudden I could sleep again. My anxiety went from, like I never had panic attacks, but it went from what I would consider for me a 90 down to a 10, back to, it took it back down, and I started sleeping again.
Mm-hmm.
I can sleep mostly through the night. I mean, there are a couple nights a week now that I'll wake up maybe once. I don't have trouble going back to sleep because I don't have those racing thoughts like I used to. I'm not waking up. And we could talk about this later, but learning about being your own detective, what are the things that, if like for me, it was alcohol. If I drink more than a glass of wine, I'm not going to sleep, right? So you kind of have to, I know it's a separate thought process, but you have to kind of become a detective for yourself. So if I'm starting to feel my anxiety, I know that it's probably time to change my patch and I've forgotten to do it. If I make the choice to have more than one drink while we're out with friends, I know that I'm going to pay for it by not sleeping very well that night. So
there's a guy named Chris Williamson. He has a podcast called Modern Wisdom, and there's a quote he uses quite often in multiple podcasts. It's somebody else's, but he said, there are no solutions, there's just trade-offs.
Yeah,
and I love that
100%.
statement because, like you said, if I decide, you know what, I'm going to have a couple extra glasses because I want to enjoy my night tonight or whatever, it's like there's going to be a trade-off to that, and if that's worth it, do it. And I don't mean that tongue in cheek, like literally, do it.
Yeah.
And one thing you alluded to there was the awareness aspect. If you know you're about to do something hard, whether it's a race or go through menopause or whatever it may be, it's a lot easier to get through it knowing what's coming, especially if you know what to expect while there, right?
Yeah.
And I've got a client who is a physician, so she knows her way in the medical world, not special to any of this, but is a physician. And she has what I would say traditional medicine would diagnose her as frozen shoulder.
Mm-hmm.
Frozen shoulder, the fancy term for it is adhesive capsulitis. And the theory is that the capsule, which is like this leathery tissue that like keeps your shoulder joint in socket, it starts to legitimately like tighten up. And usually it's the bottom of it. So it's really hard to do a couple different rotations and lifting the arm up. But every female that I've treated so far that would have been given that diagnosis essentially has rotator cuff tendinopathy or rotator cuff tendonitis. However, they are generally between the ages of 35 and 55. And I would say frozen shoulder is not a bad name for it, but because it's technically misdiagnosed, therefore it's going to be mismanaged. If you just tell a gal, hey, this is going to suck for 1 to 2 years, get through it, I mean, they'll probably do that, but it's going to be horrible.
Right.
If you say, okay, this is presenting like what we generally call frozen shoulder, but I think it's more tendinopathy or tendonitis in origin.
Mm-hmm.
You can do these strengthening things. You can expect this. If it starts to hurt, do these movements, do these stretches. And then also, if you want, you can go to a physical therapist who can do dry needling, scraping, things like that to help manage it. I educated her on all that, and she's like, yeah, I know it's probably hormone related, but I have no interest in doing hormone replacement. So I would just like to keep doing what we're doing. I'm like, totally fine.
Yeah.
Just letting you know what is probably going on here. Again, making sure she's aware.
Right.
And then makes the decision from there. True informed consent.
Right.
There's one other thing I want to talk about, and then we'll kind of get back into the next path that I want to go. But to finish this out, there's a girl named Dr. Vonda Wright. She's an orthopedic surgeon or maybe an orthopedic doctor.
She's a great follow.
Yes, she's amazing. And I think she's what took a lot of things that I noticed and wrapped them all up in a pretty bow. She had a study come out July of last year, so we're right at 1 year, called the musculoskeletal syndrome of menopause. Have you heard of that?
Mm-hmm.
Okay. So, and I've got one gal, I told you there's a gal that I'm treating right now, we're going to call her John. Clearly her name is not John, so we're good there. But she came in yesterday and I was telling her about this. And she's had hip pain for 10 to 15 years. And as we started asking more questions, it kind of traced back to right where when she hit menopause. And this hamstring pain, but then also she's also got this shoulder pain. And she said, Clayton, I feel like all my inflammation hits at once. And I'm like, well, we've tried this, this, and this, and you're clearly not tolerating the PT right now. I don't think you're doing anything wrong or me, but your body's not managing it well. And it comes back to, I think, this syndrome where her body hormonally is not operating like we want it to. And on that musculoskeletal syndrome of menopause is generally, there's other things, but one of them is like 2 or more areas of concern that generally would fall under the umbrella, tendinitis.
Mm-hmm.
And it all comes back to your body is not repairing and recovering like it should, secondary to these hormone imbalances.
Mm-hmm.
And so I'm referring her out to a hormone specialist who hopefully can help her quite a bit. And then I want to kind of push her over to you because she's been wanting to weightlift for, I kid you not, maybe 5 or 10 years. And every time she does, the pain spikes and she has to like get sidelined again. And she's really tired of this cycle. Yeah. I thought I was going to be able to help her through it because she just wasn't doing it right, or she needed a little bit of assistance, or needed to go slower.
Right.
And we've tried all of those.
Yep.
And we keep coming up kind of where she was. And so I think getting her in front of the right doctor is going to be that answer. So I would like to roll this into hormone replacement therapy. I know you are not a doctor yourself, so you can tell us your experiences and what you've had positive and potentially negative. But what was that process like going to get hormonally tested? And then what did they give you in regards of information and potential treatment options?
So, good friend Katie, who says, I just want to know the truth.
Yes.
And here's the problem. There's no truth, right? We don't have enough research on it. We literally do not have enough research on it.
Taking place-ish now.
It is. It is. And as we know, science changes, right? When you're in perimenopause, another person that I love is Dr. Mary Claire Haver. And she has this great video where she shows you what your hormones are doing throughout your cycle. So when you're cycling and you're cycling regularly, your hormones it's a sine wave. Like it's a perfect, you can track it. When you go into perimenopause, she calls it the zone of chaos.
Okay.
Because your brain is trying to get your ovaries to do the thing that they're supposed to do. And your ovaries are like, I can't do it. And so your hormones are all over the place because there's this disconnect in your body between what your brain wants your body to do and what your ovaries are capable of doing. And so if you test a woman during this time, any given day, her hormones are going to be completely different. So currently, there's no real blood test to let you know if you're in perimenopause. This is my understanding. There's no real blood test. I know some practitioners will say, what I need you to do is I need you to come in on the 21st day. I can't remember exactly what day it is, the 21st day of your cycle, right? So we're going to count from this day, 21 days later, we're going to come in, we're going to draw your blood. Because if it's not doing what we think it should be doing on that 21st day, then we know. So there are ways around it, but there's a lot of us, especially athletes, who we do not cycle regularly, right? For whatever reason, our bodies don't do that. So my 21st day may not look like somebody else's 21st day. So a lot of good practitioners, what they'll do then is they'll come in, you've got to be your own detective. You go in and you say, these are my symptoms. I'm having hot flushes. I'm not sleeping. I've got anxiety. I'm, doing this. I'm doing that. I'm doing the other thing. And a doctor who knows what they're doing when it comes to perimenopause will be able to say, oh, guess what?
Yeah, let's hear.
Let's hear. We're doing this. For me, who I am now postmenopausal, for me, it's a lot easier because we can test my hormones and we can go, well, they flatlined. Guess what?
Exactly.
Right? So
because you're no longer in chaos.
Correct.
Okay.
Well, I am not in hormone chaos.
There you go.
You are correct.
Specificity.
So, right. So it's that perimenopause stage that's really, really, really hard because there's no definitive test. There's nothing definitive that you can do. So, and that's again why it's so hard for women to go in and say, well, I think I'm in perimenopause, especially women who go in their early 40s or even their mid 40s. And doctors will go, again, I have heard where practitioners will say, well, you're too young. There's no such thing, right? There's no such thing. Women go through menopause at any given time.
Mm-hmm.
So what I tell my clients is I want you to be a detective, and I want you to start listing out and take a couple weeks to do this. All the things that you think are different now. Are you fighting with your spouse more? Are you yelling at your children more? Are you irritated at work more? Are you exhausted all the time? Are you, right? Like exhaustion is a huge one. Are you having trouble having a coherent thought, right? list all these things out and then take it to your practitioner and see what they have to say about it. So to me, it's more anecdotally based than it is, or symptom based than it is an actual blood test that you can do. And like I said, in postmenopause, then it's a little bit easier to do it. But even my doctor, so when I went in, I'd been on the patch for about a year and I said, hey, my headaches are coming back and I'm getting a little more brain fog than I used to. And she's like, oh, well, let's just increase it. Because I knew how my symptoms were affecting me. And so she was able to just be like, yeah, I trust you. I mean, that's another great thing, when a practitioner says
building
to you,
a good relationship.
I trust you.
Yeah. Yeah.
Because it wasn't a dismissal of you. Anyway, does that answer your question?
It does. And I think what I've noticed talking to different people about different topics is a lot of it seems to come back to like a parallel with physical therapy. And the thing is people will sometimes come to me either with some sort of a scan, CT, MRI, X-ray, something like that. And they'll say, can you look at this and tell me what's wrong? Or I'll look at the report. Or they'll say, do I need one of these scans? And I feel like it's similar to if someone listening right now about menopause is saying, should I go get a blood test to see if I'm menopausal or peri or post or all of those things? Those all can confirm, but they can also sometimes mislead, right? There's numerous studies that show that someone your age has an over 50% chance of having a disc bulge somewhere in your spine. Do you have back pain? Yes or no? That's the real question that I care about.
Right.
Right. And like you said, it's anecdotal.
Yeah.
You used to feel this way. Now you don't. Did something change? You're like, no, I'm doing everything the exact same. Cool.
Right.
Then your body probably changed.
Right.
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 And so it's just using critical thinking, trusting the patient, not belittling them, thinking like, no, I know more than you, honey. Like, let's not, like, trust me, you're fine. Mm-hmm. That's like the most frustrating and easiest way to just piss someone off and not actually be helpful.
Right.
And so what I've learned is when I first really got cracked into like learning more about menopause, is I had a patient who she had 2 years of symptoms, and I think she had tried one or maybe two doctors, and she was like, I feel like I just keep getting gaslit and dismissed, and they're saying I'm fine, they're saying my hormones are fine, yada yada. And then she found a provider here in Wichita that she said feels like he finally listened, and she said that the intake was this like exhaustive paperwork saying, do you experience the symptom? Like yes, no, how much, or something like that.
Right.
And it was just tons and tons of symptoms that she'd report. Then he did a comprehensive blood panel, much bigger than your yearly checkup, much bigger. And then he cross-referenced. He said, here's all the things that I see that are either off, wrong, suboptimal, whatever. Here's all your symptoms. Let's cross-reference. Sometimes she had symptoms, but no blood work to back it up. And sometimes she had blood work that was off, but no symptoms of it. So then you have to, as the doctor detective says, does this matter? Do we need to address it? Is this relevant or is this an incidental finding? And that's where I think the magic really happens, because you have equal weight and say on what you do. Well, you have full weight on what you do, but you have equal say on the symptoms you have. And the doctor needs to be that consultant that says, okay, I hear you. Here's what I think it is. Let's run tests. And then let's collectively put all the information together ultimately. And I know this study that you're talking about with the hormone replacement therapy connected to breast cancer. And please do not quote me on this. I'm not having an easy time finding it right now. But what I had found is, yes, there was a small increase in cancers.
Right.
Statistically significant. I don't remember whether or not it was, but it was very small.
Yeah.
But when they looked at all of the benefits and what happens if you don't have hormone replacement over a 10 to 20 year period, all of the secondary side effects of having essentially like sucky hormones was far and away greater, worse than just taking the small uptick in risk of cancer. So it was like, what is it? The benefits far outweigh the risks.
Right.
Far
I love,
and away.
they make these lists where they're like, okay, these are the things that are going to happen to you during menopause. So like your cholesterol is going to come up, you go up, your insulin resistance is going to go up, your there's like a whole list of symptomatic things that will happen within your body. And these are all things that you're going to want to correct with medication, right? Because if your cholesterol is going up, you're going to want to take medicine for that. If you become insulin resistant, you're going to want to take medication for that. If this happens, you're going to want to do, right? So what if we could, bone loss, right?
Yeah.
You want to take whatever. What if we could mitigate some of that stuff by just taking hormone replacement? And it's not perfect. It's not perfect. Our bodies are still changing, which I know this is where we want to get to with the whole strength training business. Yeah. Your body is going to be different. It just is.
And that's the part that I feel like you do need to accept.
Right.
Agreed?
Yes.
Now, how severe and all those kinds of things is, that's the variance. But yeah.
Right. Yeah. I mean, yeah, how you distribute weight is going to change. It just is. And it's so hard. I still haven't come up with a good way to approach a woman, because seriously, I will sit down and I will have a talk with anybody because sometimes you just want to be listened to by somebody who's been there. And I will sit down and they're like, but I've got belly fat now. I know. And there's no good way to say, there's no good way to say you're never going to look like your 20 and 30-year-old self again. You just aren't. You just aren't. And that's okay because that's a society thing, putting beauty standards on you. And we need to realize that there is value in not being a 20-year-old or a 30-year-old anymore, right? There is a lot of value in being a woman who is over 40. And, and so but it's really hard because it is ingrained in us to have a flat tummy.
Yeah. No, I know. And this patient of mine, John, that I talked to yesterday, we had a good 30 to 40 minute discussion on that because she was talking about, she's like, but now I have this belly. And it was like I guarantee you it was like barely existent. Like if anybody's seen me, it was like less than half of what I've got type of thing. I mean, it was like barely there, but it wasn't what it used to be.
Right, exactly. Right? Yeah,
and she kept alluding to like, well, I have this flab or I'm losing this thing. And I'm like, I want to let you know that when I did a men's physique competition, you had to see my eye sockets to see my abs. That was the trade-off that I had to come to grips with. And I was an asshole and I was not very nice to be around because I was so calorically like restricted. It was not fun.
Right.
And I learned, if I want to look like that, I have to feel like this.
Right.
And I have to look like that in my face. And it was horrible.
Right.
And so I wasn't telling her like, okay, you have to go really restricted to get rid of that. But it's like, there's a point where your body wants and needs that fat there, first of all, from a physiological perspective, especially women. Women need to carry more fat to maintain said hormones. But second, it's not your fault. And I'm not for like making everybody like being a victim necessarily, but it's not your fault. And so if anything, I feel like hopefully that helps alleviate some of the stress. You're not doing anything wrong, right? You're not failing to eat properly or to work out. This is how your body needs to be now, or this is how your body is choosing to be via hormones. And that's, like you said, that's okay.
Yeah. And I'm going to add on to that for just a little bit.
Please.
So we're losing estrogen, right? So when we have our estrogen, it's at a certain level. When they give you replacement therapy, it is a much lower level. It's much lower level than birth control is. It's a much lower level. It's enough to kind of make sure that, you can get rid of the brain fog and that you get right. It keeps all the systems kind of moving and shaking. So what I try to tell women is, your estrogen used to do a whole lot of stuff for you, right? It helped you with your collagen. It helped you with your blood sugar. It helped you maintain your muscle. It helped you maintain your bone mass, right? And even though, like in a perfect world, everybody would be working out. Everybody would be lifting. Everybody would be running. Everybody would be cycling. Everybody would be active all day, every day. Not all day, every day, but everybody, right? So everybody, right, exactly. People would be doing the things that they needed to be doing and they would be doing them. But we all have busy lives. We live in a city, right? Those things aren't manageable for us always, or some people just don't do them. But as you age, you can't rely for women on your estrogen anymore to take care of the slack of not doing your workout, or the slack of eating an extra brownie, or the slack of the strength training I keep going back to because it does so many great things for your muscle mass and for your bone density, right? And your estrogen used to help that. So now you don't have that estrogen to rely on. So now you're the one that has to take up the slack with that.
You have to work harder.
So, right. So it's not necessarily that you're doing, it's not that you're supposed to do completely different things. It's that you now need to be more cognizant of the things that you probably should have been doing all along because there is no slack left, right? The older we get, the less, I always call it bounce. You just have less bounce, right? Sure. You just don't bounce back from stuff like you used to. So that's how I think about it is you have to pick up for what's happening to you. So I love sweets. And if it's my birthday, by God, I'm going to have a piece of birthday cake. Or if we're on vacation, I'm going to, right? But it has to be a treat now. And it's still, I am still going to put up the consequences later. I'm still going to have inflammation from the things that I shouldn't be eating. I'm still going to, right? So does that make sense? Like
absolutely.
You're having to pick up that extra. You're having to pick up for that extra that your hormones used to do for you. And they just don't. And I know testosterone works the same way.
And people can be off in any of those three, ultimately, as they go through the chaos, like you mentioned. I want to tell you a little bit about the new life hack that I just found. It's something called the Whoop Band. It's a wearable health tracker with no screen, just powerful sensors that track your sleep, recovery, strain, and even stress 24/7. I've been using it daily to see how my habits affect my body in real time. It's helped me eat better, rest smarter, shed a couple extra pounds, and stay consistent, all because the data is personal to me. Whoop is offering my listeners at Heal Without Harm an exclusive free month. Just hit the link in the show notes to try it. Now that we've talked a lot about like what to expect, kind of like how things go, how to approach it, let's talk about what people can do.
Okay.
Right now, I know you can't go prescribing anything or anything like that, but what areas do ladies have control over? And what areas can they actually do something about? I know strength training is one that both of us are like massive proponents of.
Right.
So we can start there if you'd like. But I want to start giving tangible takeaways for people to take back with them.
Yeah.
And so what do you feel like ladies can do the most with to fight back?
So for me, and it's because it's my focus, but it is absolutely critical that they strength train, right? When you start to go into menopause, when you go into perimenopause, you start losing muscle mass, you start losing bone density. You just do. And that increases every year. By the time you hit your 60s, it is, if you're not actively trying to maintain muscle mass, you are losing muscle mass at an incredible rate, right? So it is never too late is the one thing I want to make sure I always say upfront and often to people. You can start training in your 80s. That's fine. But one of my favorite statements from Dr. Mary Claire Haver is women go into the old folks home either because they stop thinking or they stop moving. And strength training will help with both of those, right? So I'm gonna call it, it's not BCNF. It's not the railroad company. It's your brain neurotropic. You know what I'm talking about?
I don't.
Oh,
I somehow don't.
Dang it. Now I'm mad because there's a hormone that gets released. It's brain stimulating neurotropic because I keep getting it mixed up with Burlington Northern because it's a very similar acronym. Anyway, when you weight train heavily, right, you get this. This helps protect the myelin sheaths, not myelin, the sheaths of your brain, right? Because part of dementia is when you get the plaque, sticky stuff, right? And it helps protect your brain. It helps stimulate growth of your neurons and your neuron receptors. So it works wonders for your brain, helps keep, so they've done studies. In fact, I want to say they just released this study on however many women it was that said that the ones that were more cardiovascularly active and strength trained were far less likely to end up with dementia symptoms.
Yeah.
And I don't know about you, but the thought of getting dementia actually terrifies me, right? Because I've had older family members who have gone through that, and you are no longer yourself at that point. So anything you can do to keep yourself from keeping your brain healthy, right? Because it's going to change as you age. So it's good for your brain. And then also muscles are an endocrine gland, which I'm old enough to have not learned that in college.
Yeah.
But, right? So if you are having muscle, the muscle is going to help you control your blood sugar. It's going to help with your metabolism. It's going to help you burn calories, right? So and it helps you with your bone density, right? Because if you put more muscle on that bone is going to respond by becoming thicker and stronger, right? There are studies that indicate that osteopenia and to some extent osteoporosis are reversible with strengthening, but it has to be heavy.
Yes, and actually there's a client.
She's right here now. Yep.
Yeah, she's working out right there.
Yep.
And she got back from the ortho doc and they're like, we've never seen someone's bone density go up this much this fast. What are you doing?
Right.
And I'm like, what do you mean, what is she doing? You should know what she's doing.
Know what she's doing.
You should be the one that told her to do it.
Yeah.
You know what I mean?
Yeah.
Completely I don't know if she was bad enough to be reversed necessarily, but like huge uptick.
Yeah.
And what is she doing?
Yeah.
Strength training.
She's strength training.
Doing?
Heavy strength training.
She lifts some heavy gosh dang weights.
Yeah.
And do you know what age she started?
It was. I know she was in her 50s. Yeah.
And it was because she had knee pain going upstairs. And she's like, I heard strength training can help this.
Yeah.
4 years later, got into a powerlifting meet.
Yeah.
And now she probably lifts more weight than most people listening. And I'm like, gosh dang it.
Yeah. I know.
And so let's get into specifics. what would you recommend for someone to do in regards to strength training? Let's say it's my 66-year-old female.
Yeah.
She's a thinner, petite lady, and she wants to get into strength training because someone like you told her that she should.
Yeah.
What's a general protocol or a general guideline that you think would be a great place for her to start?
So it's kind of like finding a practitioner. You have to find someone you trust who's going to listen to you. So go in, meet with some trainers, find somebody who's going to listen to you and who's going to work with you. They need to teach you. So I'm going to put my plug in for Foundations Fitness.
Please.
I know all the trainers here are very careful with how they have people lift. Kate and myself it is critical to us that people are lifting correctly, because if you're not, we're going to send them to you. We're going to end up sending them to you if they're not lifting correctly. So find somebody who is willing to listen to you, but then actually teach you how to lift properly, which is the number one step. I do a learning to lift group, which we meet for 6 weeks, and I teach you how to do a squat, a chest press, a deadlift, and a couple other little things and all the stuff that kind of goes along with it, because I can't just start by throwing a bar on someone's back and telling them to sit down and stand back up again.
Yeah, exactly. That is how they do it in high school, though.
Exactly. Which is, and a lot of, a lot of women that I know, they're talking about how, well, yeah, I lifted back in high school, and which is great, but at the same time, we lift differently now. We cue differently now than we used to. So I've been doing this for 20 years. It has changed how I cue people to set up for a squat. It's changed how I cue them. So anyway,
I've changed in the last 6 months.
Right.
You kind of keep getting better at it. You learn more things.
Right. What works for you, and that's the next thing, is that every body is different.
Yes.
But everybody can lift, right? So you may not be able to accomplish a full ass to grass squat, but even if your knees are bad, and even if your doctor has said, "Oh, don't ever squat again," which that's my least favorite thing for doctors to tell people, is, yeah, you can squat. So I have an example of a woman that I've been working with who she's got the goofiest kneecaps on the planet, but we've got her doing a squat now, and it's without pain. And so she comes in the other day and she's like, I can actually feel muscle in my legs, right?
Which is not
something, and she used to, like, she would literally just fall down every now and then because her knees would give out on her. And we've got her to a point now where she can squat. We've got to modify it, but we can do it. So heavy lifting.
Sorry, you say, they say don't squat, and it's like, sir, how do you get off the toilet?
Exactly.
Because I'm pretty sure you have to squat off of it, and squat
every time I add a plate to somebody's bar, I'm like, hey, in 30 years, you're going to thank me when you can stand up off the toilet. Because that is my big thing, is I don't ever want to have help in and out of the bathroom. That's not, I have no interest in that,
For sure.
but it's all those life things, it's all those things. It's getting up and down off the toilet. It's getting in and out of bed. How are you going to pick something up off the floor if you drop it, if you can't squat, how are you going to do that? How are you going to, it's just all those.
You're doing all these things every day, I promise you.
All day, every
You might
day.
as well add a little weight to it, do it better, and get stronger to make it easier to do.
And if you have the privilege of being able to find a practitioner who can, or a trainer who can teach you how to do it properly so that you don't hurt yourself, it's really important to make sure.
What do you feel like the
that.
gold standard is for times a week to train?
Oh, if I could get women in to lift 3 to 4 times a week, that'd be great. That'd be great. Once a week, nothing is too small. Nothing is too small. But at a bare minimum, twice, 3 times is great. 4 times is fantastic.
For sure.
Right? And it doesn't have to be a 2-hour session.
No, not at all.
It can be a half an hour, 45 minutes, right? It's just enough to come in. Let's do a couple of quick things and let's get it banged out. And it does not have to be an all day thing.
For sure. So this cohort, or this intro to lifting, is it a cohort where ladies show up, they go through the course, and then what do they do from there?
Oh, well,
not course, but multiple week. Kind of thing.
It's a 6-week session. And so honestly, I just got through with my first group of women, and I would tell you 5 out of the 6 we're going to put a group together and we're going to start lifting together twice a week.
Perfect.
So they're coming in the evenings, and they're going to start, they're going to start lifting with me.
So one thing they can do is weight lift. When it comes to nutrition, what are 1 or 2 number one things that you say?
So I have Hannah's rules of thumb.
Love it.
So
you only got 2 thumbs.
Only got 2. You get 2 of them. protein is very important.
Okay.
And I know everybody who's ever been on social media, you're going to hear us banging on and on about protein. And there are a lot of different guidelines that you can. What I tell people is you want to aim for 100 grams a day. Some people want more, some people want less. But if you aim for 100 grams, it's really hard. If you think about it, if you're only eating, because I'll tell you, like, you can't really utilize more than 30, 35 grams. If you're an active person, you can't utilize more than 30 to 35
That's actually
grams
been
at a time.
disproven too. Like,
oh, okay.
They've done studies of 40, 50 grams, and they actually that actually
On
increased
who?
protein synthesis more. I don't know. Good
Okay.
question. I see your point. But if you're going to overeat a macro, why not make it protein?
Why not make it protein? So anyway,
Like,
but it's
nobody ever
hard.
questions me when I eat a whole can of Pringles. I go, what are you going to do with all those carbs? Like, I don't know. I'm just trying to eat the Pringles. But they want to like demonize you for like doing 2 protein shakes. Like, what the heck?
It's hard, right?
Mhm.
It's hard to get in that much food in one sitting also,
Yeah,
right?
exactly.
So, but yes, so 100, that's my
Cool.
rule
Aim
of
for
thumb.
100.
Aim for 100. So my women hate this one, but plant diversity, right? So the more plant diversity you get, the more micronutrients you're getting, the more fiber you're getting, because I tell my women to aim for 30 grams of protein. Gosh darn it.
You got
30 grams of fiber a day. That's really hard. If you thought the 100 grams of protein was hard, 30 grams of fiber is a lot of fiber.
But sorry to interrupt, but it's also like not that hard if you just plan your meals a little bit. Ish.
Yes.
Like, I'm not trying to make it just
no,
easy.
No. You're
But
not wrong.
Once you start making small changes, you're like, oh, wow, this adds up really good.
Yeah.
And then when you meet those 2 things, hey, aim for protein and fiber.
Okay, but I do have a question.
Go ahead.
How many times have you had, in your case, a patient come to you and go, but I don't like vegetables?
Oh, yeah, that's a good question.
So for you and I feel like I'm scolding you. For you and I, it's easy because we know, but it's really hard. And then, so my second thing is that you want to aim for a big diversity so I try to get my ladies to aim for 32 unique plant-based items in a week. And the first time I told my husband that, he's like, you can't even name 32. But so you think about it, it's seeds and nuts. It is vegetables and fruits. It is whole grains, and it is legumes.
Mm-hmm.
Right? So seeds and nuts are easy, man, because you can throw some chia seeds in your shake and you can have a handful of nuts and it's going to give you protein and good fat, right? So that's kind of easy. But then you get into the plants and the vegetables and you're like, I don't know, lettuce, broccoli, an apple, a banana, right? So it makes you think about it. So I feel very smug when I go to the grocery store because I spend a lot of time in the produce aisle and I pick up stuff that I haven't seen before. And I'm like, I wonder what this tastes like. And I wonder what I can do with this. And right. So it's kind of a game that you have to gamify it, right? And
well, honestly, this is where I think TikTok actually comes in fantastically.
Okay.
Because you can just type in on TikTok, like, how do I eat more veggies? And I guarantee you there's like 5 to 10 creators. That's all they do.
Yeah.
And they crush it. And they're like, here's how you can sneak this in. Here's how you can,
oh,
you like sweet potatoes? Here's 7 different ways to make it.
Yeah.
You can make it sweet. You can make it savory.
Yeah.
Have you ever heard of an eggplant? No. Cool. Well, how do I cook it? And there's like 19 different ways to cook it.
Right.
And so that's where it can come in huge because you don't have this Pinterest, like, this only takes 10 minutes. It's like, girl, that took me 9 hours to make. What are you talking about? It's a 1-minute video. Hey, chop it up like this, toss it in here, air fry it for 20 minutes, call it good. And then if you want to change it, change it.
Yeah.
Because I know what you mean. Like, I show up at the produce area and I'm like, apples, oranges, got it, done.
Yeah.
But then what I mean by easy, I guess I should say it's simple. Because simple and easy are drastically different, right? Deadlifting 500 pounds is pretty simple. Pick it up, set it down.
Stand up.
Not easy, right? And so simple meaning like, hey, just swap this here. What are you eating for breakfast? Nothing. Okay, can you drink a protein shake?
Yeah.
What are you eating for lunch? Well, I usually go down to McDonald's. Cool. Can you make something for 20 minutes on Sunday and then just refrigerate it?
Right.
Right. And then that's where it gets really, really hard, not complex, but hard. Can you actually implement this type of thing? And so, so we've got weight train 2 to 3 times a week, 3 to 4 is your more ideal. I get it. 100 grams of protein, 30 grams of fiber, a million different kinds of fruits, apparently. No, I'm just joking. 32 different varieties of plants and all that jazz. And then let's finish with water and then we'll have to wrap up for today.
Okay.
What is water important? How much? Any
water
idea
is super
there?
important. Water is super important. You and I were talking about this a little bit before. So what I tell people is everybody has a different rule of thumb. I tell women aim for 80 ounces. I know there are actual calculations you can run. 80 ounces is going to hit it. Right.
Oh, yeah.
And if you're aiming for 80 ounces and you get close, you're golden. And if you go over, that's fine as well. In the summer, it's probably more important to drink more. That was one thing that we didn't talk about. My training schedule completely had to change once I became postmenopausal. I trained for a marathon, the first marathon that I ran since I became postmenopausal, and it was brutal. And water and electrolytes were a huge, huge, huge part of that. So in the summertime, because you're sweating so much and your blood becomes thicker from all intents and purposes, right? And it would change. I could not run long distances. I had to, things I've never had to do before. So I would tell you, water is super important. Hydration is super important. If you can stick with it and drink your 80 ounces every day for 3 months, you will notice a huge difference in your skin. It is
I could see that.
Amazing. It is amazing. And I still struggle to hit it. So you have to find little tricks and tips to help you, right? Some people carry around a huge water bottle. Some people have to just make sure something's empty by the end of the day. Some people use a hydration app, right? Find what works for you because every human's different. But yeah, drink your water. Drink your water.
So someone's listening and they actually just want your help. They don't really care about the takeaways for today. They just want to show up and have you tell them what to do. How can they do that? How can they come to the next class that you're doing, or how can they reach out to you?
So my socials are Wichita Strength and Fitness. There's phone numbers there. That's what I would have them follow. Look for Wichita Strength and Fitness. Don't look at my personal page. It's a disaster. But so Wichita Strength and Fitness, yeah, that's the best way to do it. And I said, the phone number is there, so they can give me a call, or they can DM me or anything, or they can get in touch with you, and you can get them in touch with me.
Those things will be down in the show notes to make it nice and easy. When you get done driving or whatever you're doing now, you can just scroll down and click the link, and it'll take you to her page. Do you have when's your next program starting? Do you have a date?
I don't actually have a date yet. Okay. I need to, in order to make it run, we usually need between 4 and 6 people. So
cool. So you guys get interested so she can get the next one started.
Yep.
Pretty please. Hanna, thank you for coming on today. It was exciting to come out here to Foundations Fitness, which is where we are recording right now. So if there's a little bit of loudness and amazing music bumping in the background, that's why. If you didn't hear it, then I did a good job at editing. But if you need help making it through menopause and you don't really know where to start, you can reach out to me or anyone at our clinic, or you can reach out to Hanna, which will be in the links below. Scroll down and click those. Hopefully today's podcast helped you learn a little bit more how to heal without harm. Hanna, any parting thoughts before we go?
No, but anybody who wants to have a conversation, please reach out to me, because
I promise you, she
nice
wants to
have
help you
somebody,
a lot.
in your corner. It does.
For sure. Cool. We'll see you later. Thank you.
Thank you.